In this video, I've got a new setup. So there's new camera, new audio, new lighting, new background. So it'll be interesting to watch how this stuff continues to unfold as I go a little bit deeper in YouTube content creation, delivering eye health education and information, and all the stuff that can kind of help benefit and bless you the way it's helped and benefited and blessed me. So with this new topic coming up, it's something very interesting that I see a lot of times in the exam room. So it's a term called superficial punctate keratopathy, or SPK. What does that even mean? And this definition is going to come from what we call the Will's Eye Manual. So the Will's Eye Manual is very fascinating literature that a lot of us eye health care professionals, optometrists, ophthalmologists use to be able to reference conditions, look at different treatment methods and plans, and be able to kind of glean a little bit more if we've kind of forgotten something from school, honestly. So it helps kind of jog the memory, but also to be able to reference of what's currently available and what's currently being treated and what's the best outcome and treatment management method possible for every single patient. Symptoms can include pain, photophobia, red eye, foreign body sensation, or mildly decreased vision. This is a mild level of inflammation that goes after the corneal surface that can agitate the entire surface to make vision worse and your eyes not feel great, basically. It can almost look like these little green pinpoint particles whenever we add some sodium fluorescein staining dye to look at the tear film and the cornea and different areas like that. It often has this kind of speckled greenish looking appearance with that dye. Kind of hard to see it without the dye, but a lot easier to see with that dye. So it's pinpoint epithelial defects. The corneal epithelium is damaged in this case, that stain with fluorescein, and it may be confluent if severe, so it may be kind of hand in hand with that. Staining pattern might allude to certain etiologies, and pain is relieved by the installation of anesthetic drops. So anesthetic drops are excellent. We don't prescribe them because if you put a high amount of numbing drops in your eyes in any given day, it can cause what we refer to as corneal melting syndrome, and the cornea will literally just melt off because of too much anesthetic numbing drop. So we use it in very sparing, small amounts, basically. But it's very helpful to alleviate a lot of pain from a lot of folks experiencing this issue. There's a lot of different things that this issue can come from, specifically like at the top portion of the eye, if someone's got thyroid issues, if the eyelids are retracted back from thyroid eye disease, it can actually be due to a cause such as that actually causes the lids to go back and expose the top portion of the eyeball called the sclera, which is not only SPK in the cornea, but it can also lead to another condition called SLK, superior limbal keratitis or keratopathy. It can also be related to contact lens wear, overwearing, where you get these giant little papillae bumps inside your eyelids that can actually cause a lot of vision problems and discomfort, red eye, watery eye, scratchy eye, blurry eye, anything like that. I almost feel like sandpaper in your eyes in a way. It really does not feel good when that happens. This can also be associated with a foreign body sensation underneath the eyelids. So maybe you were out mowing the grass recently, maybe you were out weed eating, maybe you were trimming some tree branches and something got underneath the lids to agitate the whole surface to cause SPK to make the cornea really just inflamed and irritated. It can also be associated with floppy eyelid syndrome. This is oftentimes something I see a lot of times in folks who are using some level of a CPAP or a breathing apparatus at nighttime when air blows up underneath the eyelids and causes them to be extra elastic and flappy and can agitate the entire surface of the cornea as well as the entire eyeball. This one's a little bit weird. It's called vernal conjunctivitis. Basically, that can just mean year-round or even seasonal allergic reactions that inflame the eyeball with too much histamine, basically. It can also be associated with dry eye syndrome, which is a multifactorial condition that goes after different components of the eye, specifically the eyelid glands, whether they're the oil glands, the water gland, or different glands like that produce different fluids to make your eyes feel comfortable and for you to see a lot better. It can also be associated with blepharitis, which is known as an infection of the lid. So you have this crustiness. You can also have a form of it in a parasitic form called Demodex, which can be Demodex folliculorum or Demodex brevis. Folliculorum typically lives down inside the eyelashes. So like a hair follicle, basically. Think of it like that, to where these little parasitic creatures live down inside the eyelashes. Brevis tends to live inside the oil glands themselves or in different areas of the skin cells around your entire body. So brevis is skin, folliculorum is eyelash. This can be also due to exposure keratopathy, meaning that like your eyes lids are too retracted due to something like thyroid, for example, or autoimmune conditions, even like lupus, for example, that cause too much of the eyeball to be exposed. And this is just a list of some topical drug toxicities that can happen as a result of them being used to cause SPK. Neomycin, gentamicin, trifluridine, atropine, as well as any other eye drops with preservatives, including artificial tears or any other frequently used eye drop, that you might have an allergy to certain preservatives in those eye drops. So that's something to be aware of. Conjunctivitis, which is just inflammation of the connective tissue. Conjunctivitis is also associated with infection forms like pink eye, basically. You can have bacterial conjunctivitis, you can have viral conjunctivitis, different levels of that can agitate the corneal surface and make it very irritated, thus causing SPK. You can also have an entropion or ectropion. So entropion is when the eyelid, upper or lower, turns inward on itself, and an ectropion is whenever it pooches out basically too much and can kind of look red and inflamed and not that great, to cause a lot more inflammation. You can also have this as a result of trauma. Did you get something in your eye recently? Did you get punched in the face? Did you experience some level of eye trauma that caused the corneal surface to be more inflamed? This can also happen as a result of a mild chemical injury. This can mean if you got like something like bleach or an acid or something like that in your eye to rough out the surface and make it a lot worse as far as your comfort and anything like that. There's also a very interesting condition out there called Punctate Keratitis. It's just usually these epithelial bumps raised on the central portion of the cornea that can lead to superficial punctate keratopathy. And there's different ways eye care professionals like myself treat SPK. Sometimes some people need to use artificial tears. Sometimes we might need to use a bandaged contact lens. Sometimes we might need to use a steroid eye drop. Sometimes we might need to use a steroid antibiotic combination eye drop. Sometimes we might need to use an ointment. Sometimes we might need to use a dilation drop. And yes, that can actually be written as a prescription, dilation drops, which I've done a lot of times for folks, specifically for uveitis or some level of inflammation that needs to be contained and controlled with that. If someone wears contact lenses, I usually might recommend that they discontinue those contact lenses. And again, this is all pending examination findings. So these are just possibilities and information that can kind of help you gauge for if your eyes are irritated. You need to check in with your eye health professional, your local optometrist, your local ophthalmologist, whoever you depend on to have your eyes checked annually. That's who we recommend. That's who I recommend, is someone who can actually check your eyes in a comprehensive, in-person, physical way that can actually see the entire picture of your eye, both front and back, to eliminate any problems and conditions that could be promoting SPK or anything like that going forward. SPK is usually extremely treatable. I've seen it go away. I can't tell you how many times. A lot of times it takes just a low-grade steroid eye drop or a medium-grade steroid eye drop. Sometimes it takes getting people out of contact lenses for a very short season while that inflammation clears up and then get them back in it. And there's different ways that we go about treating this, and it all depends on the experience. It depends on the provider. It depends on what the patient's symptoms are and what your symptoms are that you're experiencing with this. So it's hard to say when your eyes kind of feel irritated if it's SPK or something different. This is why you need your eye health care professional to be your advocate, to actually look at your eyes, recommend a treatment plan, and be able to get on the right track for your eyes feeling better as well as you seeing better. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. I'm Dr. Bryce Heffington, and we'll see you next time.